Hi, everyone. My name is Leah Wypych, and I work for Remedy Therapy Center for Eating Disorders. And this is the first of our installments of different podcasts. I am joined with the fabulous Dr. Kelsey Latimer. She has lots of letters after her name. Yes, you do.
No, I actually do.
Yes, you do.
It's just annoying.
And we're going to do right now kind of a high-level view of eating disorders, what their diagnoses are, just to get everyone kind of acclimated to some of the things that we see here and the things that we treat. How does that sound?
I think that sounds great. Let's do it.
Wonderful. So, Dr. Kelsey, what are the eating disorders that are diagnosable, that are in the Diagnostic to Statistical Manual?
Okay. Well, there are several. There are going to be some that I think that the audience is probably going to be aware of, and then maybe a couple that obviously is part of our day-to-day, but you guys might not be so aware of. So I'll start with the typical ones that we usually hear about if you're maybe reading an article on eating disorders or watching a Lifetime movie or something like that. We typically hear of anorexia. We typically hear of bulimia. I would say those are the two main ones. And more recently, we hear, which I think is a great thing, we're hearing more about binge eating disorder as well. So I would say those are the top three that we typically hear about. So I'll give a kind of high-level overview of those. And I would love for you to jump in too, because you've been an expert in this area just as long as I have. So
Thank you.
You have a lot to offer as well. So please let me know if I'm missing anything. But in terms of anorexia, what we typically think of is people that are intentionally restricting food. And, what I want to get away from, though, is this idea that couple things, that it's all about the food, because what you're going to find out with eating disorders is that it's really not at all about the food. The food is a focus or sometimes a distraction for something else that's going on with the individual. And it really doesn't matter if it's anorexia, bulimia, binge eating, whatever it is. It's always about something else. And the food is kind of taking the stage as the main focus. And sometimes it can actually take away from what's really going on. But when we talk about anorexia, we're talking about that intentional desire to restrict food. Oftentimes it's because maybe the person feels uncomfortable with themselves. They maybe are trying to protect themselves from some sort of trauma that has happened. And the other thing I want to get away from is this idea that anorexia is all about a particular number. I think that is a very kind of stereotypical way of looking at anorexia. Yes, we can have some people that are underweight for sure, but you can't tell what type of eating disorder somebody has just by looking at them. And there are a lot of people with anorexia that actually live in higher weight bodies as well. So I think that that's very important, that we're focused more on kind of what are the factors that hang together the disorder versus just looking at a number on a scale.
I'm really glad that you brought that up, because I think that traditionally in our culture, we think of thin, young Caucasian girls.
Yes.
And I would love for our society as a whole to really branch away from that, because eating disorders affect all races, sizes, creeds, religions. It's everybody. It can be men, it can be women, it could be trans. It really does not discriminate at all. And luckily, we're starting to see that trend change a little bit. But of course, in society, we still kind of tend to think of teenage girls. So.
Absolutely. And you are so right. And I mean, here at Remedy, we see a variety of different people. We see people from all of those backgrounds that you talked about and a variety of different ages. So that is like spot on and so important. Thank you for adding that.
Of course.
The other, just to make sure that the audience is aware of the other kind of major disorders we see are bulimia. So that a couple of the sort of key factors there might be taking in large amounts of food and having some sort of purging behavior that goes along with that. And the compensation, I should have said maybe even compensation, can be a variety of different ways. It can be your classical kind of way of purging behavior. It can also be excessive exercise. What other ones am I missing that people do when they're
They might utilize over-the-counter
Yep.
medications to expel things, whether it's laxatives or diuretics. But I do want to touch a little bit more on the compulsive exercise, because
Yes.
that's a big piece, because people really think about vomiting, and so it's not always about vomiting. It's really just expelling all and utilizing and using those calories to typically try to have a calorie deficit is what they're trying to do. And just like with anorexia, it is very much based on a lot of body image. They have
Absolutely.
a very negative body image.
And
So,
even jumping further than that, it's not even just body image, it's also self-view.
yeah.
You know, with bulimia, so that our audience knows, and I really want to speak to, if it's you out there that's suffering from that, that there's oftentimes a lot of shame that goes along with that. And if I can just kind of speak to you right now and say that, you know, you have a place here where you can experience a zone that is free of that shame. We are here to help. We know that this, again, it's not about the food. It's about something that you're suffering from, probably, again, an underlying trauma or something that has happened. And this is an incredible way that you, probably without knowing, tried to gain some control over your life. And at some point, it's just that the eating disorder, what it gives to you, takes more than, or it ends up taking more from you than what it gives to you. And that's the point where, you know, we look at treatment or options to get help. Would you agree with that?
Absolutely. And I also want to point out that pretty much all eating disorders are very that you wind up being very secluded. It's very much behind closed doors. There's a lot of shame. There's a lot of guilt, particularly with bulimia. You know, you hide what you're doing to compensate for the food that you're eating, and that can be really challenging, to really be isolated and not have anybody to talk to. And that's why here, to have individuals who speak the same language, also individuals on our staff who are in recovery themselves who speak your language, I think that really speaks volumes to each of you out there who might be struggling with these disorders.
I'm actually so glad that you mentioned isolation, because I think that is a really, really important factor related to eating disorders that is often kind of missed. But think about it, like how much of our culture is surrounded by food, you know, not just our culture, but any culture. It's surrounded by food, and that's how we connect. And so if we can't partake in food for whatever reason, you know, whatever the disorder is, it's automatically going to isolate you from the people around you.
Absolutely. Absolutely.
I was wondering, I know I've talked a little bit about anorexia and bulimia. Do you want to tell us a little bit about binge eating?
Yeah, binge eating disorder has actually been on the rise over the past few years, maybe past decade or so. It's actually one of the most diagnosed, I feel like, at this point. Binge eating disorders is similar to bulimia, just without the purging, without the compensation for intaking the calories. So individuals will eat what is considered a large amount of food in a very short amount of time. Now, that can also be a little subjective to whether it's the clinician or the individual, but an actual trained eating disorder clinician will be able to pinpoint if it's true binge eating disorder or somebody who overeats or something like that. Because there can be, with a lot of eating disorders, kind of this interesting line where, you know, to come somewhere like Remedy or speak with a clinician who's trained in eating disorders, they're able to really tease out what is a disordered, like an actual eating disorder.
Yeah.
So.
And kind of even bouncing off of that, I think what we see when you said that, I was thinking, you know, it's not cut and dry a lot of times. We can have even that behavior of binging can be sometimes a part of other types of disorders. And also for our audience out there, I think it's important that they know that the disorder can change. It's a sneaky disorder. It can change over time, you know, so it may start out as what looks like anorexia in a textbook, you know, and then a year later it may be we have different behaviors that are maybe turning into bulimia. And then at another point in time, it might look a little bit more like binge eating disorder.
Absolutely. I think that as individuals change, the eating disorder behaviors can change too.
That's a good point.
You know, our bodies change. So it's, you know, like, okay, what else can I do to have my body, if it is body-based, what else can I do to have my body look the way that I want it to, or what else do I need to make sure that my feelings I'm not feeling, or what have you. So
Yes, and it's all about that. Like, I don't want to feel the feelings
I
that
don't want
I'm
to feel the
feeling.
feelings.
Yeah, and so what can I do to get rid of that? Whether it be restrict, binge, purge,
Yep.
or any of those things.
Absolutely.
Do you think that treatment centers are, or shall I say, do you think that like people with binge eating disorder are able to get treatment these days in higher levels of care?
I think they're absolutely able to get treatment, and I do believe that there is amazing treatment out there. I know that we have a great set of clinicians and staff that can work with individuals with binge eating disorder. I find that some of the issues really wind up being is the lack of acknowledgement that it's actually an eating disorder. A lot of medical providers will simply say, oh, you just need to lose weight in order to lower this, that, or the other in your blood work. They're looking at a purely medical component rather than what's the underlying cause and what are the issues, like what are the mental health issues underneath. I think that in higher levels of care, you know, we definitely pride ourselves in being accepting of all body shapes and sizes. We also don't use weight. It's as a factor of health. Your health is really more, how are your labs? How is your emotional state? What's going on inside your body? Because your natural set point for your weight might be larger than what you think it is or smaller than what you think it is. And it's our job to work on those underlying issues to help your body also get to that set point, get to where your body is content and happy and fully functioning. So Dr. Kelsey, there's this eating disorder that's called ARFID, which I know a lot of people get. They're like, what is this? And it's a shortened version of avoidant restrictive food intake disorder.
Yes.
Can you tell us a little bit about ARFID?
Yeah, sure. I feel like it is one of those things, it may be completely new to you. If there's one in here that we're talking about that you've never heard of before, I would bet it's probably that. But I do think that there is a lot more talk about it in the news. And I would say one of the ways that at least I've seen it is a lot of association with discussion around, say, sensory issues, autism. It's not uncommon to see that come up. But I do want to also distinguish that many people have ARFID outside of being neurodivergent. So I think that's one point to bring up. But yes, ARFID is really, it's the disorder that is, we're restricting food, but what distinguishes us from, say, anorexia is that you're not intentionally doing that. You don't want to restrict the food. You're not trying to accomplish some sort of weight goal. In fact, you might be distressed about if you see your weight going down. And there are no body image issues associated with it. So that's a really key distinguishing factor. You can have, sometimes people have an overlap where they may have anorexia and they may also have food restriction that goes along with ARFID. So there are three main areas when we're talking about ARFID that exist. So the first one is a trauma-based ARFID. So think about it as, you know, a person maybe goes through their life, they have no issues with food relatively, and then all of a sudden they're eating pizza at a pizzeria and they choke on the cheese. And then all of a sudden they can develop a fear related to eating that. Like, what if that's going to happen again? But for some of us, we might have experienced some of that. But what really distinguishes it, though, is that for this person, it might kind of go overboard. So now it's not only is it going to happen again, but like, okay, well, cheese, I can't eat any cheese, right? So I can't put it on my pizza. I can't put it also on any of these foods. And then, oh my gosh, it's kind of stringy and it's, maybe it looks a little bit like this food over here. And then what if I choke on that? So it starts to maybe sort of compound on itself. And before we get, before we know it, we're down to eating a very few number of foods that maybe are safe for that individual. So that's one of them. It could also be a lot related to textures and smells. There's something called sensory processing disorder that is really all around that, how we take in senses. There are thousands of senses that are coming into our body right now. We're all processing them. We might not even realize it, but for individuals that have ARFID, with this type of ARFID, everything might be very overwhelming to them. And so those 5,000 senses are coming into us now. They're experiencing every one of those individually, and it becomes overwhelming.
I feel like with this one in particular, I think that a lot of people can understand, like there are certain foods that you don't like because of the texture or the way that it crunches or something like that. But when it comes to ARFID, it's basically taking that times 1,000. It's avoiding the food entirely and adding additional foods as well to being like, nope, it's too close or whatever it is.
You got it. Because I mean, even there's a distinction between, say, ARFID and a picky eater. You know, you can be a picky eater, but still be completely healthy, functioning in your life. You can go to events. You might just be somebody that doesn't love tons and tons of things, you know, but a picky eater is not ARFID. ARFID is where we get down to a dangerous number of foods, and it's really impacting our medical status. And you know, we've seen people, sometimes the most dangerous, medically critical people, sometimes it's ARFID. It's not necessarily anorexia with body image issues.
Absolutely.
And it's something that we feel pretty comfortable, I think, treating here as well.
Absolutely. We do a lot of exposure work when it comes to our clients with ARFID here at Remedy Therapy Center for Eating Disorders. We actually work with them really, really well. It's been very interesting to see that some of the out-of-the-box thinking that we've done, especially when it comes to our meal planning and with our registered dietitians and the way that they've worked with those clients with doing some of those exposures, and also working with them on them picking out some of their exposures, I think is really cool too. So,
and stair-stepping it.
Yes.
Right?
Starting with baby steps. Got to start with baby steps all the way. What's the third area that you were mentioning?
Which ones have I mentioned? I mentioned trauma-based. I mentioned the textures. And... oh, the third one. I was like, what is the third one?
I don't know. I don't know where you were going with this.
The third one. No, there is a third one. And that's generally, this is an interesting one. I think we see this less frequently because these people might have been picked up very earlier in life, but it's people that really lack an interest in food altogether. Not necessarily something happened, but maybe they might have been picked up, I said earlier in life, because sometimes they even have what's called a feeding disorder, which we don't do. That's a little bit different than what we do here with eating disorders. But yeah, there's a complete lack of interest in food altogether.
Oh, that's very interesting. I don't think I've ever even heard that.
Yep.
I guess that makes sense, though.
And I think as the research, continues, we'll probably hear 5 or 6 different types, down the road.
Yeah, I feel like over the years there have been, the DSM that actually lists out the official diagnoses. They've morphed and changed over the years, sometimes for the better.
Yeah.
For instance, anorexia in the past, one of the key components to having anorexia is that you had to lose your menstrual cycle. Well, males don't have a menstrual cycle to lose, so that is now no longer included in that diagnosis. So I always like that it is being reviewed and looked at and changes with what we're seeing with these clients. I know that we talked a little bit about healthy eating, clean eating. Now, is there some disordered stuff going on with that?
Well, I mean, I would definitely say it's something we hear a lot about. The buzzword around that is orthorexia. Have you heard of that term before?
I absolutely have.
Yeah, so that is a buzzword that those of us in the eating disorder world have heard about for quite some time, but I feel like general culture has really kind of caught up to us and talked a lot about additional terms that were not even around at the time, as like clean eating. And like you said, I see a lot of people that get kind of caught down a path where maybe maybe they're starting just like anyone else. It's the new year and I'm going to be healthier. And then the difference, though, is that 10 people might start that, on a Monday, and by Friday, they're all eating normally again, except for 1 or 2 individuals that start going down a major path. And again, they can start to sort of eliminate to a dangerous level the amount of things that they're eating. Ultimately, I usually see that underneath is some of the same things: safety, a sense of like, it makes me feel good about myself. It makes me feel confident or morally like I'm okay, I'm doing the right thing. Do you see anything in addition to that?
I do. Well, and I also want to point out that I tend to get the question quite often of individuals asking, what's the difference between clean eating or healthy eating? I'd like to use that in quotes, and an eating disorder. And I really like to explain to them, like, look, if you are trying to get the nutrients that you want and that your body needs, that's great. And when it turns into more obsessive, when you aren't going to dinner or meals or events with meals with friends or family, that's when it can become an issue. If you're specifically, oh God, sorry.
I know, I see the little
Get
gnats.
away from me.
You can just pick them up though, nobody can hear it.
Hi. What's that?
Keep going, it's great.
Okay, so when you start to specifically eliminate yourself from the world because you have to have this set meal or this set snack at this exact time, that's when it becomes an eating disorder, because it's
Absolutely.
impacting your life rather than being more health conscious and trying to make sure that your body's getting the fuel that it needs. And that's also why I explain to people, if you even have a question, go see a registered dietitian who specializes in eating disorders to help you kind of wade through that to make sure that it is in the best interest of your health and not an eating disorder.
I love that. And I'll also add too, when people have questions about whether or not they have an eating disorder,
They probably do.
you probably do, honestly, because, you know, that doesn't happen unless there's a part of you that's saying, hey, maybe this is a little bit overboard. And that's the time to catch it, you know, is when it's teeny tiny and it's just brewing before it starts to take over your life and more of your life.
And if it does wind up taking over more and more of your life, that's when I say we are absolutely here to help. Right now, we currently have a residential treatment center, so it is one of the highest levels of care, and we absolutely work with individuals who have orthorexic tendencies, anorexia, bulimia, all of these diagnoses that we've discussed today. So I want to thank you for your time and
welcome.
being my friend and
Being the yin to your yang.
being the yin to my yang. I do want to let individuals know that if you are struggling with any of these eating disorders, Remedy Therapy Center for Eating Disorders is a residential program. We are here to absolutely help with anyone. If you're a friend, family member, and just have questions, we're happy to answer those too. We have individuals available 24 hours a day for a consultation to just talk with you about our programs, maybe some of the stuff you're struggling with. We do work with insurances, and we are here to help. So Dr. Kelsey, I would love to continue this conversation with you and maybe do a deeper dive if you'd like to.
I would absolutely love that. You know, I'm always here for you.
I appreciate that.
And I do want to say to all of you out there, you know, you deserve more. You deserve better, and you can get better. So one of the ways to do that also is to, if you like this conversation, support us, you know, give us a like, give us a thumbs up, or whatever people do on social media these days. That way we know you want to have more of these conversations.
A like, a follow, or a subscribe. We'd be happy to have you. Yeah, one of those words. I'm not really sure what they are. And I would just like to close out by saying recovery is absolutely possible, and it's a beautiful thing. So thank you for joining us.